Introduction. Welcome, students, to the comprehensive course on musculoskeletal examination techniques. In this course, we will delve into various topics related to the assessment of joints, spine, axial skeleton, and other crucial areas of the musculoskeletal system. Throughout this script, we will provide detailed instructions on examination techniques, interpretation of findings, and the relevance of each topic to clinical practice. So, let's begin. This topic will focus on the examination techniques used to assess the presence of fluid accumulation within a joint. Joint effusion can indicate various underlying pathologies, such as trauma, infection, or inflammatory conditions. We will explore both physical examination findings and imaging modalities used for diagnosis. Additionally, we will discuss the significance of identifying joint effusion in the management and treatment of musculoskeletal disorders. The evaluation of spine curvature, including kyphosis, lordosis, and scoliosis, is crucial in diagnosing and managing various spinal conditions. We will discuss detailed examination techniques, such as postural assessment, range of motion evaluation, and neurologic examination. Furthermore, we will interpret the findings and highlight potential implications in terms of patient pain, functional limitations, and possible referral to a specialist. In this topic, we will delve into the examination of the axial skeleton, including the skull, ribs, and vertebral column. Special attention will be given to identifying abnormalities or injuries through inspection and palpation. We will discuss the importance of recognizing signs such as deformities, tenderness, or step-offs, which may indicate fractures, infections, or neoplastic processes. Understanding these examination techniques is crucial for detecting and managing axial skeleton-related pathologies. The shoulder joint is prone to several conditions, including impingement syndrome and rotator cuff tears. Therefore, students will study a range of provocative tests used in the evaluation of these specific shoulder conditions. We will provide detailed instructions on performing each test and interpreting the results. Additionally, we will discuss the clinical significance of these tests in diagnosing the underlying shoulder pathology and guiding appropriate treatment strategies. This topic will focus on specialized tests used in the evaluation of hip joint disorders, such as femoroacetabular impingement or labral tears. Students will learn the indications, techniques, and interpretations of each test. We will also highlight the importance of these tests in determining appropriate treatment approaches, including surgical interventions or conservative management strategies. To gain a comprehensive understanding of the musculoskeletal system, students must learn how to assess the neuromuscular function of the lower limbs. This topic will cover detailed examination techniques for evaluating muscle strength, tone, reflexes, and sensation. By mastering these assessment methods, students will become proficient in identifying various neuromuscular disorders and differentiating them from musculoskeletal conditions. The evaluation of foot and ankle stability is crucial in diagnosing and managing conditions such as ligamentous injuries and balance issues. This topic will cover assessment techniques that include evaluating ligamentous integrity, joint range of motion, and balance. We will introduce specialized tests and discuss their interpretations, facilitating accurate diagnosis and appropriate treatment planning for patients with foot and ankle pathologies. Assessing the function of the cranial nerves involved in facial muscle movement is essential in diagnosing various neurological conditions. In this topic, students will learn examination techniques, assessment of symmetry, and identification of any abnormalities. We will discuss the clinical significance of cranial nerve examination, particularly in diagnosing facial nerve palsy, Bell's palsy, or other cranial nerve-related disorders. The dynamic stability of the knee joint is crucial for optimal knee function and preventing injuries. This topic will focus on evaluating the dynamic stability through tests for ligamentous integrity, patellar tracking, and muscle strength. Students will learn the techniques and interpretations of each test, enabling them to identify underlying knee joint pathologies and providing appropriate recommendations for management and rehabilitation. Differentiating tendinopathies from other musculoskeletal conditions can be challenging. This topic will provide students with detailed examination techniques specific to tendinopathies, enabling them to identify specific tendon injuries accurately. The differential diagnosis will encompass conditions such as tendinitis, tendinosis, and tendon tears. By mastering these techniques, students can provide targeted treatment strategies for patients presenting with tendon-related complaints. The importance of pre-participation musculoskeletal screening in athletes cannot be understated. This topic will emphasize the specific examination techniques and tests used to identify potential injury risks and optimize performance. Students will learn to assess muscle strength, joint stability, flexibility, and overall musculoskeletal functionality. By conducting thorough evaluations, students will aid in preventing sports-related injuries and optimizing athletes' performance. Joint hypermobility syndrome is a condition associated with increased joint laxity and various musculoskeletal complications. This topic will focus on the examination and assessment of joint hypermobility syndrome, including the Baton score and other diagnostic criteria. Students will learn the implications, management, and potential complications associated with this condition. Understanding these aspects is crucial for providing appropriate patient care and minimizing potential long-term musculoskeletal complications. Congratulations on completing this course on musculoskeletal examination techniques. We've covered a wide range of topics, from joint effusion to hypermobility syndrome assessment. Mastering these techniques will help you diagnose and treat musculoskeletal issues effectively. Thorough examination skills are crucial for excellent patient care. Best of luck in your future endeavors.